The real winners for the home-based care system will be the patients who can now take ownership of their care needs. For example, the idea of traveling long distances for a checkup could be daunting. Now, they'll be able to get the care at home with no need for scheduling visits in advance. This empowers people by giving them more control over managing chronic health conditions like diabetes, asthma, and invaluable improvement on their quality of life. Can the future of healthcare be in your own home? Well, home healthcare is a trend that has been growing for some time. It continues to grow after the pandemic. This is because it is the future of healthcare delivery. So let's take a closer look at why treatment at home will be the next frontier in the healthcare. Chronic diseases affect more than 40% of the population in the United States. That means that there will be more people who will need care than ever before. And with more people living with chronic diseases and illnesses, it also means that healthcare costs will be higher. This also means that family members or the caregivers will need to dedicate time to make sure that those they are caring for live as long as possible. As society gets older, it will be important to help people age well. There is not enough of a workforce in hospitals, so it's easy to imagine that most healthcare decisions will happen in the homes where people live with families and friends that they trust. Receiving treatment at home makes it much more comfortable. It also lowers costs, provides patients with greater comfort, reduces risk of infection, and improves recovery rates for patients undergoing surgery or chemotherapy treatment. If you're new to the channel, welcome. Topics that I cover on this channel are digital health, senior housing, senior living, aging in place, and technology for older adults. We also talk about caregiving and longevity. So please subscribe to the channel, press that like button, click on that bell icon to get notified when there's a new video. Let's embrace the aging journey as we walk together in the best part of life. In this video, we will look at a three-part solution to fix the problem between the hospitals and homes. Then we will look at where we are now and where we could be in the future if these suggestions are used. First, let's consider the people. We need good trained workforce to care for patients in their home. This includes those who help simplify processes so that daily tasks can take place effortlessly from anywhere. It also means having clinicians use technology to facilitate communication to their patients and healthcare workers to ensure everyone gets the proper care. People have always been the backbone of healthcare. Today, people are more than just doctors in white coats working in a back office tending to patients. They're also nurses, receptionists, support staff, and many more. They're everyone who helps make up our strong community. Society demands healthcare become more affordable, accessible, and effective. And what better place for this type of collaboration than at home? Part 2, which is the process. Home healthcare professionals have been delivering care for years, way long before the pandemic and even when it was difficult to do so. During that time, people who provide home care learned how best to do their job by working with patients in the home. They learn about social determinants of health. This is something that not many people were thinking about back then. With the rapid pace of changes in healthcare, providers need to be able to innovate quickly and streamline their workflows. Smart systems can help them meet increased patient demands while reducing administrative overhead so they can focus on what matters the most, providing excellent care. Part 3, which is the technology. For many, technology is the differentiating factor for the success. What has had a bigger impact on how they communicate with other people is not being tied down by location or some old equipment. They can stay in touch and organize while working remotely. Providers using cloud-based software had an easier time transitioning because they could adjust seamlessly on the fly. Healthcare is complicated. Still, it can be made more efficient by delegating responsibilities to those with expertise. When care delivery is taken away from its normal boundaries, like doctors' office, hospitals, it can be given to those who have command over processes such as operational management and revenue control. They can lead to more effective care for the patient and a more effective operation for the provider. In this complicated system, it is always hard to measure these operations, but the providers who know how to monitor these operations will have an advantage against others without any knowledge or guidance. Let's go through where we are right now. Unfortunately, the truth is we're stuck with the same old care delivery model, which favors providers who own and operate the physical locations for patients. There's a lot of flexibility in scheduling or pricing, which can make some procedures unaffordable. Imagine the future where care providers compete to deliver quality healthcare directly. This reduces costs for the patients because they are not paying expensive hospital bills. A future with care centered around patients' needs instead of relying on how providers have operated in the past may be closer than what you think. We will get there more timely when we embrace the value and the potential of those providers who have consistently delivered care at home. Next, I'll share with you where we potentially could be. The real winners for the home-based care system will be the patients who can now take ownership of their care needs. For example, the idea of traveling long distances for a checkup could be daunting. Now, they'll be able to get the care at home with no need for scheduling visits in advance. This empowers people by giving them more control over managing chronic health conditions like diabetes, asthma, and invaluable improvement on their quality of life. The exponential adoption of telehealth was a significant event, but technology lets us connect without leaving our homes is what makes healthcare accessible anytime from anywhere we want, as many times as we want. So together, people who have the right skill set and streamlined processes and a cloud-based technology will make better care for patients much easier. If you're new to the channel, welcome. Topics that I cover on this channel are digital health, senior housing, senior living, aging in place, and technology for older adults. We also talk about caregiving and longevity. So please subscribe to the channel, press that like button, click on that bell icon to get notified when there's a new video. Let's embrace the aging journey as we walk together in the best part of life. Do you have any thoughts? Do you have any suggestions? I would love to know them. Please comment below.